This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our regular programming to bring you a special report, an update on the spread of COVID-19 in Erie County. We want to go live now to the studios of WQLN Public Media. Here's Erie County Executive Kathy Dahlkemper. All right, while they get set for Kathy Dahlkemper to begin her news conference, I want to let you know that the state had their news conference. Okay, from the control room, are we ready? All right, let's go to Kathy Dahlkemper.
As we talk about COVID-19 and the pandemic here in Erie County, we were hoping that this day would never come, but I am deeply saddened to report to you our first death of an Erie County resident. This gentleman in his 80s had some health complications, was diagnosed with COVID-19 on March 29th, 2020. He unfortunately passed away last evening at Allegheny Health Network St. Vincent Hospital. Our deepest sympathy goes out to this gentleman's family. Our thoughts and our prayers, and the thoughts and the prayers of the whole community, are with you at this very difficult time. We are truly blessed to have a facility like St. Vincent Hospital here in Erie County. The leadership and staff at St. Vincent Hospital have truly been valuable partners in this fight against COVID-19, and they took utmost care of this gentleman, as they do with all of their patients. We know that each patient diagnosed with COVID-19 who goes to St. Vincent Hospital has his or her own specific team and unit dedicated to their care. So thank you so much to the caregivers and to the hospital staff that was assigned as a team to take care of this gentleman. Thank you for all of your efforts. Also, unfortunately, as we had suspected might happen after the Easter holiday weekend, we also have quite a few new cases to report today. We have 7 new positive cases of COVID-19 in Erie County today. 6 of those are in their 20s and 1 is in their 50s. We know that 6 of the 7 can be connected back to known positives, and investigation continues on all cases. This brings us to a total of 75 positives, with 1,492 negatives. Contact tracing continues by the Erie County Department of Health staff. All 7 of these new cases are located in Zone 1, and you can find that on the cumulative cases map by zone at eriecountypa.gov. The good news is we now have 44 recovered cases to date out of the total 75. So that means 31 active cases as of today. All of this information can be found on a new chart that is located under positive cases on the COVID-19 page of eriecountypa.gov. This new chart breaks down the cases by cumulative cases, active, recovered, negatives, deaths, and quarantine and isolation numbers. And it'll be updated with new information as available. So you will see on this new chart that we have had a total of 399 isolation and quarantine individuals. So you'll be able to find that information updated again as we have it. I ask each of you to please continue to act as if everyone you come in contact with is a carrier of COVID-19. Because as you can see, the virus is still spreading. We have seen 19 new cases in the past week. If you all have a desire to get back to work and get our economy moving again, with a target date of May 8th to possibly begin reopening, it's more important than ever to practice social distancing, to practice good personal hygiene, and to always wear your mask to help slow the spread of COVID-19 in Erie County. The state numbers are at 38,652 total cases with 1,492 deaths. That is a 1,599 new case record in the past 24 hours. Chautauqua County has 29 cases and 3 deaths, and Ashtabula County has 98 cases and 7 deaths. Our environmental team received 46 new complaints in the last 24 hours, and they are following up on these calls and continue to make field visits to educate and assist our businesses with being compliant. Tomorrow, Karen Tobin, the Environmental Branch Director at Erie County Department of Health, will be joining us to share an update on how we are doing so far. I should say she is the Environmental Branch Director within our COVID-19 team. We continue to work with the governor's team on a plan to start reopening businesses during this first phase. We again want to express our appreciation to all of you who have been working hard to comply with the guidelines set forth by the state and by Erie County Department of Health. We will provide more details next week as they become available. In the meantime, please stay home. Continue to physically distance yourself at a minimum of 6 feet from anyone who does not live in your home with you. Continue to wash your hands regularly for at least 20 seconds, as well as sanitize and disinfect surfaces. And continue to wear your mask. When you go out to work, shopping, or even a walk, wear a mask. Your mask protects me, my mask protects you. This guidance and so much more can be found under resources on the COVID-19 page at eriecountypa.gov. If you need information or assistance from the enforcement team, go to eriecountypa.gov or call 451-6700 or email ecdhinfo@eriecountypa.gov. And now, today, I would like to welcome Dr. Lynn, President of LECOM Institute for Successful Aging, to say a few words to us. Dr. Lynn?
Hi, thanks, Kathy. I am happy to be here, and I'm here as a resource to help answer any questions that the community may have.
Did you want to talk at all, Dr. Lynn, about the work that you're doing? We wanted to particularly hear about, so many people are concerned about their family members who may be in a senior living center that they can't visit, and maybe if you want to just talk a little bit about that, that would be great.
Sure, I can give our audience some perspective. As you know, you mentioned even our first death in Erie County, it happens to a vulnerable elderly individual, usually with comorbid conditions. So as a operator and a medical director of several skilled nursing facilities, my job is to protect the residents that are currently in our buildings and also help facilitate a unit or a care standard that we can help transition patients coming from the hospital back home. And we're fortunate in Erie County that the number of COVID cases and our capacity is well under what we were preparing for. And our community really got together with acute care hospitals, all 3 hospitals here in town, Mill Creek Community Hospital, St. Vincent's, and UPMC Hammett. We work really closely with them in trying to coordinate the transition of care. And having said that, it still presents a lot of challenge because our issues are not taking care of a lot of positive cases. Our challenge is that since we have such a low COVID number in our community, want to keep it that way. So it's imperative that our vigilance has to be high. So as you mentioned, social distancing, wearing masks and hand washing is certainly very important, and particularly in the skilled nursing facility level. So I can only speak to what we do here at LECOM with our 3 facilities. We're the first skilled nursing facilities to restrict visitors from the outside. We're the first facilities to actually have universal masking way before the governor made the recommendation of universal masking. And I just personally believe that wearing masks and washing hands, these are common sense approach that we can help protect the community, and we should have that practice not only in their skilled nursing facility, but also, obviously, in the community at large.
And one other thing I wanted to ask you, Dr. Lynn, is if you could address so many people who can't see their parents, their grandparents, who, because of those restrictions. Do you have any suggestions for any of us on how we can best support our loved ones while we cannot actually physically be with them?
Yeah, and I think one of the things in the face of a crisis situation, all of us can come up with very creative ways to accomplish same thing. It may not be exactly the same, but I think one of the ways that we do is via technology. So we have set up schedules, and we have helped families and patients to connect via Skype and via video conferencing or Zoom. And we had multiple 101-year-old birthday parties, despite the fact that they can't come visit. We're able to set it up so that they could see each other through a glass screen. They can come celebrate from the outside by video. And it's posted on our Facebook page at the Institute of Successful Aging if people want to know. But our activity directors, our social workers, our case managers are very creative in doing those things. And I think actively engaging patients and family members on a daily basis, setting up a schedule, can help. And a lot of our elderly patients, they look forward to that, becomes an activity, so they look forward to that.
Well, thank you so much. I'm going to turn it over to our media for questions either for myself or Dr. Lynn, and we're going to start today with Jet TV.
Hi, Kathy. It's Samir. I guess, do you have any more information surrounding the Settleman's death? Do you know what zone he was from, how long he was in the hospital, how severe his condition, how severe his conditions were when he was hospitalized, etc.?
I don't have all of that information. We have the information of where he was when he passed, and some of that type of information that I've already spoke of. Of course, this gentleman would be in the population who we know would be most vulnerable to the effects of COVID-19. And we've been talking about this from the beginning, that many people who might get COVID-19 in the younger ages, even though there have been certainly tragic deaths across the nation, would be less vulnerable, but it would be the people that they may come in contact with. And so many people, 25%, don't even know that they have COVID-19. And so hence why I know so many, I think every senior living center has now not allowing any visitors to come in to protect those individuals. And I'm not sure how this individual even contracted COVID-19, so I don't want to say specifically, this was the case. But it just goes to show that they are the older, the elderly in our community are the most vulnerable. And again, it's tragic, and it's always terrible to lose a loved one in your family. And so, again, I'm sure the family is grieving, and we as a community grieve with them.
And following up on that, do you happen to have a number of how many cases are hospitalized, or if any are on ventilators currently?
I do not have that number. I believe last night Dr. Chris Clark might have been on TV speaking about how many cases they had currently in their hospital, but that would be the only way I would know.
Right, yeah, I was wondering grand scope. I mean, there's other hospitals just besides that. But, all right, thanks.
Sure. Erie Times News?
Yes, Kathy, it's David. I didn't quite catch it when you started. Did you say what day the gentleman who died, what day he was admitted to the hospital or not?
No, I didn't say what day he was admitted. I said the date in which he was tested for COVID-19, which
what?
I'm just looking back on my note here for a second. March 29th.
Okay. And as formality, will you say who he is? Will you identify him?
I will not identify. That's really up to the family. I respect their privacy, just as we've not given any names out about anyone who's positive, and certainly not in this case. I truly believe that's up for the family to decide if, when, and how they would reveal that their loved one has passed.
Okay. And then the 6 cases among people in their 20s, are all 6 of them connected? Have you traced any of these back to certain gatherings over the Passover and Easter holidays?
So we have 7 new cases today, and I know that 6 of them are directly connected to known cases, and one we were still working on that in terms of the contact tracing. I don't know if all 6 of them, or 7 of them, I mean, were, of the 6 that are definitely known to be of a contact were of the same contact, but I believe some of them are connected in a similar way to a same person, but I don't know how many that is. And again, it looks like this week we've had a lot of new cases, and many of those can have that connection back to someone close in their life and who's positive. And so we do believe that some of this was people gathering at a time when we were hoping people would stay apart. And this, of course, is a concern going forward, too. And we have to all remember that you never know who might be carrying that COVID-19, because many people don't have any symptoms, or their symptoms are minor. Erie News Now?
Hi, a question for you regarding the possibility of starting to ease restrictions on May 8th. Any clue when businesses can expect to learn whether or not they'll be among those who are able to reopen in some capacity?
So, having had conversations yesterday with the state, we're going to be having I think a more robust conversation early next week with the state, meaning our region, and we hope to have a lot more clarification at that point as to which businesses will open and which businesses will not. But there is that 25-person threshold that was definitely brought to my attention, and that is going to be somewhat of a guide. So any business that couldn't limit to 25 people total, but again, I don't know if that has anything to do with square footage and all those other issues. So we're going to get more clarification next week from the state.
And what should businesses be doing now? I know you've talked about trying to develop plans and such. Any more just advice for business owners here as they're waiting to learn whether or not they may reopen? Any other suggestions for them to try to be as ready as possible?
So I would suggest that a business look on our website under the business resources and look under the guidance that was put out for the life-sustaining businesses. And it's really very good. It's a very good document, and it really will help a business see what they would need to do to reopen. So it gives guidance regarding masking, regarding hand sanitizing, regarding temperature taking, and who needs to do it and who doesn't, and even though it is highly recommended that every business do it. So I think if you look at that guidance, it will give you a very good starting point. And then I do think any business who believes they might be in that ability to reopen during the yellow phase, that they start to put together a very comprehensive plan for how they would implement this reopening for their business, which would only be 2 weeks from today, so it's never too soon, obviously, to start planning for that. Talk Erie?
Yes, good afternoon, Kathy. It's Joel Natale. Wanted to ask, with this increase of 10% of new cases and of course now this tragic death, and I was looking at the Unicast scoreboard, and we're at a D+. The rest of the state is at a C. Are you thinking that maybe that the stay-at-home order has reached a point of diminishing return, or people not taking it seriously? What's your thoughts?
I guess we're going to have to wait and see what happens next week. I do think that, we kind of thought this week would be where we would see a bump from Easter, if there was going to be one, because it doesn't happen overnight that you are exposed and then come down with your symptoms. So we're hopeful that people are starting to understand how important this is. Of course, universal masking was not so much in effect a couple weeks ago as it is now. And so we're asking people to look at that as an additional tool to try to really stop the spread of COVID-19. It's in our community, it's out there, people have it, and they will infect others if they have it, and they may not even know that they have it. So that's what you have to remember. So I don't know that I can say, that it's because people are not social distancing as much as they were 3 weeks ago. It's hard to say, but it does concern me as we look to potentially 2 weeks from now going to be from the state into the yellow phase, which would be a lifting of the stay-at-home order And of course, every single one of us looks forward to that day when that would happen so that we could actually go and see the people we care about again. But we have to remember, even if that happens, we have to stay 6 feet away and we have to wear a mask. We can't go up and hug and shake hands and do the things we would normally do when we would greet people. These things have to change for now. And so I guess this is maybe a warning to all of us. It's a bit of an alarm for all of us that we can't let up on this. This virus is not going away, and it's going to be here for many, many, many months, and we all have to be vigilant, or we will slip backwards to a point where we will be more like some other communities across Pennsylvania and across this nation and across this globe.
Quick follow-up. I mean, on the plus side, since 6 of these 7 cases are related to a known positive, isn't this just an indication of more contact spread and really no indication of community spread?
That's right. I mean, it's a contact spread because they were around somebody who was positive. But now these 7 people also have been contagious. So who were they around? So if they were not social distancing a couple weeks ago, 10 days ago, and then now were they not social distancing going forward even in the last few days before they found out they were positive, you know, could they spread it to other people that they know, but it's still spreading across the community, and then now it goes into potentially another family, and so that's how this happens. And I know a lot of people, I've heard some stories out there. I've heard some really great stories, and there's a lot of really good things going on, but I've heard some other stories that are hugely concerning to me about people not taking this seriously. And so I cannot begin to stress enough how serious this is, that all of us do the physical distancing, that we wear our masks, that we understand there's going to be a day when we're going to be able to be with people again, but we're still going to have to stay 6 feet away from them. We're still going to have to wear a mask. Jet TV?
Thanks.
Mm-hmm. Jet TV, are you?
Yeah, hi, Kathy Samir. So as we do continue to see an increase in cases, and now we have this first death, do we think we are still on track and it's the best move to, I guess, move into that yellow zone or phase?
Well, I think we're still way below the threshold that the state is putting forward. Again, they're using data, and I think that's really smart to use data to inform how they open up the state again. You know, somehow we have to get our state and our economy back up and going, but we have to do it in a way that doesn't threaten, obviously, the lives of people in our communities. So, you know, I think that we are still in a very good place. We've done a lot of hard work over the last 5.5 weeks in this community, and I say that very collectively, certainly at the Department of Health and certainly with our other partners, but the people of this community have done a lot of hard work, and it's not been easy. In fact, it's been very difficult, but we can't let up. And honestly, we're not going to be able to let up for a very long time. So if we can kind of get into that mindset of this new normal, that's going to be the best thing. Erie Times.
And then just to follow up to yesterday with Twinbrook, has there been any discussion with you or any health officials regarding that, or have you spoken with the agency that owns the facility?
So my understanding is the Department of Health, the State Department of Health, is very aware of the situation now and taking the lead on this. I've spoken with Representative Harkins, and we're working in tandem with the state to try to rectify this issue. You know, anything that would harm any citizen of our community is something that we're all collectively going to work on, and so that's what's happening. But the State Department of Health is taking the lead on this at this point. Erie Times News.
Yes, Kathy. In follow-up to that, have you heard from any of the other nursing homes in Erie County that they are willing to accept COVID-19 patients? Other than the LECOM facility that started doing that a couple weeks ago.
Well, I believe others have the ability to do that. I've spoken at least a couple weeks ago about Pleasant Ridge Manor having a special unit, and just in case there was any need there for COVID-19 care. They don't have any COVID-19 positive people there at this point, but I don't know if there's others, but I'm assuming some others may have done the same to have a special unit sort of set up and ready, but obviously we know it's been out in the news, and we had video of it. What LECOM has done has been also a great service to our community. So I believe there's plenty of facility beds available at this particular time, that there's not a need to create more than what we already have available in our community. And I don't know if Dr. Lin wants to speak any further to that piece.
I think that we have weekly, bi-weekly meetings with our task force among all of our partners and stuff, and all of us collectively try to follow the guidance of CDC and the Department of Health. So I think all of us in this industry are trying our best to protect our current residents based upon those guidance. So I believe all my colleagues in the other facilities are doing the same. So.
Thank you.
Dr. Lin, it's David. Just wanted to see, can you tell me how many folks you've had, how many COVID-19 patients you've had at the unit since you opened it up a couple weeks ago?
The new unit's admission, majority of the cases, I would say, we have not had any positive patients that are within our facility. I can tell you that. We have had potential admissions that we know was positive, and one has not come in. The other one has recovered and then came into our facility. But all of those people are all in that isolated wing, so all of our residents in our facility were not exposed to anywhere near those patients because they're in the negative pressure room. So we really haven't had a whole lot of volume in terms of COVID positive patients, but we're utilizing the purpose of that unit is really to really screen and quarantine patients that are leaving the hospital, because up until about a week ago, testing was not really rampant. They were not testing a lot of, because of the limitations of testing swabs, we were still very selective in who they screen and swab. And I've been an advocate for anybody who's coming into a skilled nursing facility, they must be tested. And we have to have 2 negative tests before we can let them out into the general building or back to where they're back to home, because that's where, as Kathy mentioned before, majority of people are asymptomatic, and as a nursing home operator, we just can't take that risk not testing these people. And it's been extremely difficult for skilled nursing facility to actually get enough testing supplies, and we've been working with the governor's office. We've been sending letters to him to urge him that he really needs to actually prioritize testing for skilled nursing facility folks. So that's where we're at.
Thanks, Dr. Lin.
Erie News Now.
Good afternoon. A question for you regarding Twin Brook. You talked about the state now working to rectify that. From a public health, from a county health perspective, in your eyes, what would be the right solution there? What would be an ideal solution for Erie County and public health as a whole? Ideally, if you had your druthers, what would you like to see happen there?
Well, I don't know enough about the internal workings of that corporation or even that specific nursing home to really speak to that. But from everything that we've been able to deduce, there is not a need in Erie County for more skilled nursing beds for COVID-19 positive patients. So if we don't have that need, I would prefer that more of those beds are not created, and certainly would very much prefer that no one be brought into Erie County who is COVID-19 positive and not a current resident of our community.
And have you heard at all from the state on what it is trying to do? And have you passed those concerns along to the state as well on behalf of the county?
So the state is very well of the concerns of this community as a whole. And again, they are the ones, and I don't have any details about, their internal workings and their communications with that corporation. Talk Erie?
Yes, I have a question for Dr. Lynn. I'm concerned for the population of senior adults that he deals with, and certainly Erie County citizens. It would probably be difficult for people in senior living to know someone with COVID, but it's probably with thousands of people that have been laid off or without work. Probably a lot of the seniors know somebody who has been doesn't have an income right now. What is that doing for the stress level of our seniors? What's the impact on a behavioral health standpoint for our seniors of the stay-at-home order?
Well, certainly we have to be a little bit more vigilant in terms of recognizing and identifying depression symptoms. And we, at least I can speak for the patients that we take care of and or the communities that we operate under. Our staff member, activities directors, our social workers, we're constantly screening and making sure that we check up on them and checking in on them, making sure screening for depression type of symptoms. And I don't think, what you just mentioned is more of a broader issue, right? It's not just the seniors that are under stress. I mean, if, a lot of people are out of jobs because our economy are still closed, that's certainly going to stress not only the elderly, but the entire community. And, to me, really, it's for us, there is definitely going to be a new normal after this pandemic, but we really need to use common sense to move forward. We all know what we can do to prevent the spread, and having that knowledge also means that we can behave in a way that we can actually move on with our lives. And as businesses open up, we should be able to get back to a new normal that we're just more vigilant.
I guess I'm concerned, as far as children and grandchildren who are usually financially supporting seniors that may be in congregate living situations, and they can't do that now because they're out of work.
Yeah, I don't have more comments to say about that. I'm not really sure at this particular time. Any other way of not restricting will put a lot of people at risk. So it's one of those new normals that I think people have to overcome, unfortunately.
Thank you.
Jet TV, do you have any last questions?
Yeah, I did want to talk a little bit about the mask implementation at the county buildings. Do you know if the county-owned facilities have started to pass out the face masks yet, I guess, to employees there? And then do you have an update regarding face mask distribution to the community?
So we have implemented mandatory face masks throughout Erie County's buildings. And so employees all have a mask themselves, or we're providing them if they don't. And so that has already started this week. And next Monday, we are going to start temperature taking of any employee coming into any of our buildings. So they will have their temperature taken prior to coming to work, or as they arrive to work, I should say. And in terms of mask distribution in the community, we are working with the Medical Reserve Corps, who we're finally getting to a place where I think they're coming together with Mask Erie and Serve Erie and Grace Church, and this Medical Reserve Corps is helping to launder all the masks that have been made, and then to, in a very clean and safe way, putting those masks then into a bag, a little baggie, where then they can be distributed, and then they are returning those to Serve Erie, who is helping to get those out to various populations who may be struggling a little bit more to obtain their own masks. And so this is getting going, and I hope it to be very successful as it continues on.
Thanks.
Sure. Erie Times News, do you have any final questions?
Yeah, Kathy, if we are able to go to yellow May 8th as hoped for, will that have any impact, do you see, on the planned furloughs for the 100 or so county workers?
At this point, that will not change our furloughs, which will happen on May 1st. As you know, we said that most of our furloughs are from the library system, and so we are working on what would it look like to reopen our libraries, and we have this, obviously the state is helping to guide on that aspect. Most libraries in the state actually are not under county governments. They're independent and tied to the Department, I believe, of Education. So we're kind of following the guidance of the state on that regard. So with that happening, we will not be making any change on our furlough at this point. Erie News Now, do you have any final questions?
I do. One final one, please, regarding senior living facilities. If a patient there tests positive or if an employee there is positive, what is the senior living facilities obligation to families of people living there? Do they have to let families know about that positive case?
I'm going to ask Dr. Lin to answer that question since that is in his wheelhouse. Dr. Lin?
Yeah, so when there is it was recently the CMSs came out a few days ago that we would have to report it to the CDC as well as report it to notify patients and family members. So in our facilities, what we have done is we have a call system where we will send out a call where we would notify the family that's next of kin or emergency contact on the patient's chart, and we would notify everybody that we do have a case or not a case. We do not identify, obviously, the name of the employees and or the patient due to privacy issues.
But you would let families of everybody living there know that there was at least one positive case in the facility?
Yes.
Thanks.
And Talk Erie, do you have any final questions?
Just one last question for you, Kathy. Are you able to confirm that no County of Erie employees have been diagnosed with COVID-19?
I am not aware of any County of Erie employee that I can think of. I don't believe there is any County of Erie employee diagnosed. I'm just trying to think back over 5 weeks, and I can't think of a single instance of any of that coming forward to me. So I will confirm that. I'll confirm that for sure tomorrow, but I'm pretty darn sure right now that we don't have anyone. I don't remember any case coming in front of me that was even a suspicion of that. Okay?
Thank you.
Sure. Anyway, with that, I want to thank again Dr. Lin for being with us. He is the president of LECOM Institute for Successful Aging, who does great work in our community trying to help all of us to reach that golden age in a very successful way. So thank you for joining me and all of us here today, Dr. Lin. And again, thank you to our media. And finally, just one last note of condolence to our family who's lost their loved one, and I ask the community to please join me in keeping this family in your thoughts and in your prayers over the coming days as they grieve the loss of their loved one. In the meantime, I ask all of you to continue to do what we've asked you to do, to please keep your social distance from anyone who doesn't live in your home at a minimum of 6 feet, to continue to wear your masks when you are outside of your home, whether you're going to work, whether you're going to the store, whether you're going for a walk, and to always remember to stay home and to stay safe and to stay calm. Thank you.
You've been watching today's update on COVID-19 from Erie County Executive Kathy Dahlkemper. A quick recap now. Kathy Dahlkemper revealing that Erie County now has its first COVID-19 related death. A gentleman in his 80s who was tested and diagnosed on March the 29th. He passed away at St. Vincent Hospital. Again, Erie County's first death related to COVID-19. Dahlkemper also saying there are 7 new cases to report, 19 now in the past week. 7 new cases, 6 of them in their 20s, 1 person in their 50s. She said that 6 of the 7 have already been traced back to contact with a known positive. That 7th case is still being investigated. Now, the total is 75 cases in the county right now. By the way, all 7 cases, all 7 of the new cases are located in Zone 1 on the county map, which is the city of Erie. As of this afternoon, let's take a look at the numbers now. Confirmed cases. Right now, The state's website shows a total of 75 confirmed cases of COVID-19 in Erie County. You heard Kathy Dahlkemper confirm that. We have had our first death, a man in his 80s. Crawford County is reporting 19 cases. Warren County still has 1. 29 confirmed cases in Chautauqua County with 3 deaths. 98 confirmed cases in Ashtabula County, Ohio, with 7 deaths there. Now, across Pennsylvania, there are 38,652 positive cases of COVID-19. That's an increase of almost 1,600 in one day. 1,492 people have died. That's 71 more in the past 24 hours. More than 147,000 people have tested negative. The best advice, as always, we say it every day, but it bears repeating. Stay calm, stay home, wash your hands often, social distance, keep that 6 feet between you and other people, and wear a mask. Jet 24 carries a live digital exclusive coronavirus newscast every day, 3 times, 11:30 in the morning, 3 p.m. and 9 p.m. on our website, yourerie.com. We will, of course, have a complete wrap-up tonight on Jet 24 beginning at 5 o'clock, including a conversation with 2 people from Erie who were diagnosed with COVID-19. I want to thank you for joining us. We'll see you at 5. Good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.